Good evening, ladies and gentlemen. We welcome you today to this special session on the topic Natural Biotics for COVID-19, an Integrative Medicine Approach. This program is organized by Aasana Yoga Studio in Muscat under the patronage of Embassy of India, Oman, in collaboration with Center for Integrative Medicine and Research, NITI, deemed to be University, Mangalore. This special session is part of run-up event to commemorate the 7th International Yoga Day 2021. Please allow me to heartily congratulate and express my words of gratitude to the Indian Ambassador of Sultanate of Oman, His Excellency Munu Mahavar, and the staff at Indian Embassy who have been continuously supporting yoga organizations to promote and spread the knowledge of yoga to the masses and the community in Oman. Aasana Yoga Studio is one of the most esteemed yoga organizations in Oman, actively participating in spreading the knowledge of yoga and meditation through our regular yoga classes, workshops, seminars, corporate events, and community services. For more detailed information, you can always visit our website and social media, of course. We will now have a short 1-minute video to show you a glimpse of our organization in Oman. Okay, let's come back to our topic. Just to brief you on our topic today, we see the current situation, everything that's happening around the world. We have started to understand the importance of yoga, meditation, and proper healthy diet. Yoga is a life science known to humanity for thousands of years. Since then, many have practiced it in the contemporary times. Yoga acts to bridge the gap between the physical body, the mental well-being, and the emotional state of a person. Health benefits attained with regular practice of yoga are innumerable. However, yoga alone is not enough. Healthy diet is one of the key factors that makes or break an individual's health cycle. It is often rightly said, if you don't take food as a medicine, you may end up taking medicine as your food. And the knowledge of right kind of food to be consumed has become more and more essential in today's changing times. Various faculties of science have given us immense knowledge in the field of diet. Now naturopathy is an evidence-based science using natural elements to support healing and managing chronic ailments and diseases. We have with us Dr. Arun Tejas, who is a veteran in the field of diet and naturopathy. Dr. Arun, thank you very much for joining us today in your busy schedule. Dr. Arun is currently working as an assistant professor and head of the Center for Integrative Medicine and Research in NITI, deemed to be University Mangalore. He previously worked as a senior researcher with Sri Chitra Tirunal Institute of Medical Science and Technology, Trivandrum. Today, Doctor will be shedding light on the topic, Natural Biotics for COVID-19, an integrative medicine approach, giving us an idea how different food and its derivatives helps us in fighting against various infections. So Doctor, I now hand over to you to take us through your enlightening session.
Thank you for having me here. I'll directly go with the presentation. So we know the present condition about COVID-19, and we were also discussing, also coming into the yoga day soon. So this makes a very relevant topic: what to eat, what not to eat, and what all the things you should include in your diet has become more and more conscious. People are conscious about it, and there are more and more evidences supporting to this fact that our immunity and our resistance, all it depends on what we eat. So I'll be sharing some components that showed evidence to the purpose of some, use this as a adjuvant therapy or as an add-on therapy for your upgoing treatment, and which will, use it in a natural way. So if I talk about the present condition, we have almost 80,000 publications on Corona COVID-19. Almost 50,000 on the way in another 4 or 5 months, and 2 paper that's making changes, which are I'm going to share. So that would change our perspective about COVID-19. So one paper which is talked all about, which is in cell metabolism, and this, as we know now, we did the postmortems and all of that related to COVID. And we know that by this publication, elevated glucose level favor SARS-CoV-2 infection, and that leads biggest changes in our immune system. So it says the replication of the virus become more when you have more glucose in your body, and cytokine production also increases by this event. So you may end up having breathlessness. So this pathway is a game-changing pathway, because we know the glucose, if the glucose is helping the virus to replicate, which means if we eat glucose during the COVID time, glucose means whichever comes in, in our diet, almost 60 to 80% of is carbohydrate, and that's end product and glucose in your cell. So the study more says that virus replicates more with increase in glucose. And when coronavirus replicate faster when cultured in the blood cells of an obese patient. An obese patient also can have insulin resistance and elevated glucose level. So when they cultivated this cells, cultured the blood cells from obese and diabetic patients, the coronavirus replicates more, which means these groups of people are in danger situation. So coronavirus bind receptors, ACE2 is upregulated with increase in glucose level. If in your body the glucose levels are more, then AC2 receptors are upregulated, and more this uh, viruses is going to enter inside your cells. So this is the coronavirus. It has a spike protein, and this protein has to get attached to AC2 receptors in your cell, and if it get in, the virus get inside your cells and use the things inside your cells and start multiplying. So this ACE2 receptors is upregulated once you have higher level of blood glucose level. By stating this, you should understand your blood glucose level should not be high. So increase in glucose is increase inflammatory cytokines. So one of the main reason to have cytokines from inflammatory cytokines production is too much. I'm going to that pathways. So by these studies, what we need to understand is high glucose level will increase the viral infection and replications. So virus will become more, and also infection, virus replication also will become more, and high glucose level in our blood increases cytokine storm. I call it like firestorm. So to understand in a common language, so glucose level increasing, two problems. One, virus will increase, replication will increase, and then thereby cytokine storm can go high, and that cytokine storm, like a fire, will kill the lung cells and patient can die. So this become very relevant when your food is rice and wheat based carbohydrate, and which will increase the spikes of blood glucose level. As we know, if your food is rich with, you are going to get energy from three sources. From one is carbohydrate, second is protein, and third is fat. And most of the people on around globe, the main source of energy is glucose or carbohydrate coming from rice, wheat, ragi, all the grains, or potato, starchy food, which has carbohydrate, which is eventually end up as a glucose inside the cells, reach the destination of any carbohydrates, and as an energy source, it will reach to your mitochondria and produce ATP and ADP. So the glucose will increase, or the rice or wheat based carbohydrate will increase the glucose spikes, and that glucose spikes is definitely going to increase the viral replications, and the cytokine storms also going to be high. That's what the study shows. So this is the tricky question that we have. So it's not going to be more than 6 months of you're in a disease. It's not like a AIDS virus. It's the SARS COVID is going to be 2 weeks, 3 weeks, that's a time. So do you want to take that time, consume starch and increase the viral replication, and then you can take the treatment, or you don't want to take starchy food during that time, so the replication can be reduced and thereby you get the benefit? Which one you want to choose? You want to take carbohydrate and then the medicine and then the medical management, or you don't want to take the starchy food and then help your body to heal it? So which one you wanted to choose? That's a thing that you have to decide. So during any viral infection and even cancer, there is a 10-fold increase in glucose uptake by metabolic rewiring into Warburg shift. So in a normal cells, the glucose has to enter inside the cells through GLUT1 or which the pathway, and then glycolysis happens and pyruvate happens, plus oxygen, it goes into the mitochondria and then produce ATPs, adenosine triphosphate, and carbon dioxide will be released. So this is a normal mechanism when you take normally food and these things, and what happens in a normal cells. But when virus infection or cancer cells, there is this Warburg shift that happens. The glucose will go through the same pathway, but not through the pyruvate pathway, through the lactate pathway. Through this lactate pathway, the ATP production would be only 2. From one molecule of glucose, you get 2 ATP. But here you get 36 ATP. So ATPs are energy. So in a simple language, you get very less energy when there is a viral infection. So glucose uptake increased tenfold because of cell required 36 ATP from one glucose molecule, and you are not getting it. That's why most of the people will feel so much tired. So glucose is derived to the hexosamine biosynthetic pathway for cytokine secretion. So as I showed the earlier picture, when it goes to the pyruvate pathway, it produces 36 ATP. When it go to the lactate pathways, then there is a production of cytokine secretions. So hexosamine biosynthesis pathway, if you inhibit, otherwise you go to the pyruvate and produce ATP, 36 ATP, that's not happening. If you go to the other pathway, the cytokine production will be more. So if you can inhibit this pathway, study showed 100% of influenza virus infected mice survived when hexosamine pathway was inhibited, while 25% survived in control. Which means when this pathway is inhibited and the mice were infected by influenza virus and they were in a control group, they were survived. Which means if you inhibit this pathway, there is a chances of survival. How to inhibit this pathway? Reduce the virus titer when hexosamine biosynthesis pathway is inhibited. So reduce the virus titer. So when you are infected and you don't eat carbohydrate rich food, then there is a reduced virus titer in your cells. And that is how you can inhibit hexosamine biosynthetic pathway by not taking carbohydrates. So conclusion of this scientist, it's not my studies, this is published in Cell. So conclusion of this scientist, elevated glucose directly promote coronaviral replication, cytokine production, and the subsequently T cell dysfunction and lung epithelial cell death. That's how patient dies. Thus, targeting this metabolic pathway may provide a new therapeutic strategies for COVID-19. A simple thing that you have to do is do not consume carbohydrate or starch during any viral replication, to be very clear and precise. So there is Dr. Ashok Jainer, is from UK National Health Service. He has given an interview previously in a channel, and that's the main few things that I wanted to make very clear from his point. When you feel feverish, immediately stop starch food and have only soups and juices without sugar and additives. No rice, no roti, no biscuit, no milk. That's what he said. The same point, I'm taking it here. No junk. You have this 5 days time before things get worse. If you infected and if you start showing symptoms, immediately you need to stop starchy food. And the other point which I wanted to escalate this year, 30 minutes of exercise, vitamin D, or sunlight, or pranayama. These are the points that he clearly said. And then sleep early. So here he has mentioned this hexosamine biosynthetic pathway in an indirect way by saying no rice, no roti, no chawal, no roti, no biscuits, no milk, no potatoes. So which means starch is inhibited. Hexosamine biosynthetic pathway is inhibited. Once it inhibited, the cytokine production will be less. If it is less, there is less chance of having COVID related problems and death. So you need to understand this virus has some spikes protein, and this spike protein will get attached to the host cells. There is a receptor here, that receptors will bind and then cell fusion, and this then this virus get inside your cell. So as soon as it's any virus, let's say any virus, get inside the cells, what it does is there is something called interferon lambda, which take the viral RNA outside and kill the virus. So there is something called interferon lambda, which will be production, which it will produce by our immune response, and that will take the viral RNA out. So it's here, the viral RNA out, and once the viral RNA is out of the body, it just dies. So that's what happens. So interferon lambda spikes proteins get inside the cells. These points you remember. And when you consume vitamin C rich food, what happens? The study shows that interferon alpha, vitamin C is an essential factor on antiviral immune response that through production of interferon lambda at the initial stages of influenza A virus infection. So any viral infection, vitamin C must plays an important role in the first line by increasing the production of interferon lambda. So other things like what are the herbs? So in a fruit, we have just said about vitamin C. So you need to be conscious about what are the food that you can be taken even in a daily routine, that which is citric acid production food, which is vitamin C. So how does it help? Maybe not in the later stages, but these things should be in your part of your life, and it has to become your lifestyle. And the herbs to fight COVID. There are few studies about Tinospora coriacea against SARS-2 COVID protease and surface glycoprotein and RNA polymerase. Efficacy of natural compounds from Tinospora coriacea. Then glycyrrhizin, licorice, deglycerated licorice or glycyrrhizin in licorice. There is a component in licorice called glycyrrhizin. Roots neutralized SARS-2 COVID-2 in vitro by inhibiting the main protease MPRO. So there are studies has been conducted in different herbs and cell cultures, especially in licorice roots, which are found in everywhere in the world. The bark of the tree will be used for making some decoctions in many countries. And the other one were bromelain from pineapple, a component that's in pineapple helps. Like bromelain inhibits SARS-CoV-2 infection in vitro E6 cells. By there is a bioactive molecules in pineapple, which is called bromelain, and a study shows that demonstrate bromelain isolated from pineapple stems and used as a dietary supplement. Treatment diminishes in expansion of ACE2 and TMPRS2 in vitro E cell cells and dramatically lower the expressions of S-ectodermine. Importantly, bromelain treatment reduced in interaction between S-ectodermine and vitro E6 cells. Most importantly, bromelain treatment significantly diminished the SARS-CoV-2 infection in the cell cultures. So these are the promising studies. I'm not saying that if you consume these fruits, COVID SARS-2 virus is going to leave you, but these are the promising studies. These are, I can hear my voice, excuse me. Yeah, these are the promising studies that suggest that there are natural components for reduction and inhibiting SARS-2 virus. So this pathway, see, once this the protein which has the protein spike protein the virus has, that will be inhibited by bromelain. So for an example, bromelain, these are the receptors, these are the protein binder. It will get bind with the receptors here, and then this would come and get inside your host cells. So what happens, bromelain inhibit these and the spike proteins part will be removed. Then there are other components like coconut. Coconut is well known that there are many studies is one conducted and said it is antiviral, it is antibacterial and antifungal properties that coconut has. So what is in coconut makes so antiviral? We would see a study, lauric acid. So lauric acid is medium chain fatty acid, which is abundantly I could say it's the biggest source of lauric acid. Natural source is coconut, and second would be.
Doctor, there's a little hissing sound. Is there anything can be done?
Can you hear now?
Yeah, a little hissing sound. Maybe from the phone or any other device.
It's gone now?
Yeah, better.
Okay. So from the coconut.
There, it is still there. I don't know. I'm not sure. Anyway, you can continue, doctor. Something at the background, some background, some sound is coming. Is your mic okay?
Yeah, mic is okay. Is it clear now?
There is a slight hissing sound, but you can continue, doctor. Yeah.
Okay, fine. So lauric acid is medium chain fatty acid or triglyceride, medium chain triglyceride, that inhibits the maturation of vesicular stomatitis virus. So what is that component? Almost researchers were trying to find out. See, the second biggest source of lauric acid for us is breast milk. So primarily the first source of natural source of lauric acid, almost 50% is lauric acid, and almost you have 60 above percentage of medium chain triglyceride. And this lauric acid, once it is reaches in your body, it's converted into monolaurin. And there are studies suggest that monolaurin can monolaurin is a component that has come from lauric acid, and this lauric acid is largely present in coconut. So monolaurin with BHA was the most effective virucidal agent in that it revoked measurable infectivity from all the virus it is tested. So we could see a potential benefits of lauric acid, a lauric acid derived uh, uh, product, which is called monolaurin, that could inhibit many viral activity, or you can reduce the reduce the viral load by using this monolaurin. So perspective of monolaurin against SARS-2. Some studies even in Indonesia, it's happening that how monolaurin can work against SARS-CoV-2 virus. So most of the viruses has this lipid bilayer. They suggesting that the lipid bilayer, if it get a hold, the RNA comes out and the virus will become inactive. That may be the reason. And there are some other very long chain fatty acids. I was telling about the medium chain fatty acid, which is lauric acid. And there is something called very long chain fatty acid, which is very obvious to see, like omega-3. Omega-3 fatty acid is one of the most important essential fatty acid that we need, and that benefits like blood omega-3 fatty acid and death from COVID-19. COVID-19, a pilot study where you don't have enough amount of omega-3 fatty acid. Omega-3 and omega-6, these are essential fatty acids. This are comes under the category of essential nutrients. 13 vitamins, 10 amino acids, 20 micro and macro elements, and 2 essential fatty acids, nothing but omega-3 and 6 are the essential nutrients that is required, your body required, and that should be getting it from the food. And once you don't have this 3 in your body enough, there is a high chance of that you will get inflammatory process that can happen more. So they hypothesis like conducted a pilot study on 100 patients to test hypothesis that RBC, EPA plus DHA levels and omega-3 would be inversely associated with the risk of death by analyzing omega-3. So if the EPA DHA content is less in your blood level, there is high chance that you can die because of the inflammation. So I would say this omega-6 fatty acid, omega-6 means you get it from refined oils and grains, and that induces two series of prostaglandins, and that is inflammation. So cytokine storms and these inflammations that can happen when you have too much amount of omega-6 arachidonic acid in your blood. But when you have omega-3, as you can see the picture, that reduces the inflammation. There is a break, not break, the accelerator is taken out. You're not pressing anymore, so the inflammation is not more. You get 3 series of prostaglandins, good eicosanoids we say, that reduces the inflammations. And then from the 3 you get to 2 derived products called resolvins and protectins, like they remove the ashes. If there is a fire, there is a activity in the cells, and there is debris or waste material which is there. So the third stages of the inflammation, which is resolutions and protectins, take out this resolution, clean it. That's derived from the omega-3. So such an important factor that it is required in your body daily basis. And most of the omega-3 sources are seaweed or sea algae, and from the sea algae fish get it, salmon, mackerel are the fishes that which is rich in omega-3. Stimulating the resolution of inflammation through omega-3 polyunsaturated fatty acids in COVID-19 rationale for COVID omega F trial. So studies are happening. Omega-3 fatty acid derived mediators that control inflammations and tissue homeostasis. As I was saying, omega-3 fatty acid derived mediators like resolvins and protectins are the potent molecules that control the inflammation inside the cells, and bring back the tissues homeostasis, bring back the tissues normal stage called homeostasis. So probe resolving inflammatory effects of the lipid mediators of omega-3 fatty acid and its implication in SARS-CoV-19 infection. So see, omega-3 acid, if it is rich in your body, there is less chance of you getting any inflammatory related issues, which is why people largely use omega-3 supplementation for joint problems like inflammatory conditions, like chronic inflammatory conditions like joints and they say it's good for your eyes and good for your brain and good for your blood to be thin. All this, that's because it has anti-inflammatory uh, uh, properties. And these omega-3 is one of the main source of your even your brain, and your eyes is having too much amount of omega-3, and that is very essential for us in terms of inflammation. So pro-resolving effect of resolvin D2 in LTD4 and TNF alpha pre-treated human bronchi. For an example, if you have bronchi or this inflammatory related bronchitis and all the inflammation which is affecting your upper respiratory tract infections and inflammation, and the omega-3 derived products which is resolvins and protectants is very helpful. And the another one biggest thing that you need to focus on is vitamin D. So vitamin D and COVID, there are lots of studies and publications that's happening now, and vitamin D is one of the cheapest source. As I said, 45 essential nutrients are required for you in a daily basis. In that, B12 is animal source, and the second one, which you the vitamin D, there is no food you can get it. You can get it as a supplement, and you can fortify food, but naturally you will get vitamin D from sunlight. So having sunlight, that's why even I would correlate that. It is not causality but correlate, tradition wisdom like yoga and ancient yogic sciences, they prescribe or they ask you to do sun salutations, but nowadays we are doing it inside the AC room. But if you do get sunlight, these are also the some of the health benefits, maybe, which is why such things are being promoted. So vitamin D, once you have in your body, there is a two peptide which is produced by vitamin D, which is cathelicidins and defensins, and these two are like helpful for us to produce some antibiotics naturally in your body. So till now we were thinking vitamin D is just for calcium absorption and things like that, and doesn't really make any big changes. But recently the study shows that it produces cathelicidin and defensin, and that have a major role in defense system, your immune system. So human cathelicidin inhibits SARS-2 COVID-2 infection by killing two birds with one stone. So it's a premium research article. It has come, cathelicidin and defensin pathway. So this cathelicidin will make the it's like a hole it will make for the virus, and the DNA will escape and the virus will not be even active. So another one is cathelicidin and defensin. So cathelicidin, how as I said, the spike protein. See, the COVID virus has a spike protein, and that spike protein should get attached with our cell membrane. So once the cathelicidin go and block this, spike blocking will do with the spike proteins. So the spike protein will not be able to attach with the host, and also ACE2 clocking. So cathelicidin go and uh, block this ACE2. ACE2 is the one receptor which has to receive this virus inside our body. So that is inhibited, and also the spike of the protein, spike protein of the virus will be spike blocking. By these two methods, the virus will not be able to enter inside our body. And there are some studies shows Europe's highest coronavirus death rates in Belgium, Spain, Italy, France, UK, and Germany was less, Greece was less, Latvia less, Slovakia less. This average vitamin D of and also most of the people who died was there in old age homes. It's very well known fact. So the vitamin D concentrations of those people from Belgium, Spain, Italy, France, UK, those who have died because of corona, was low. The vitamin D level in the blood was low. But Germany, Greece, Latvia, Slovakia, people had higher levels of vitamin D, and thereby the death was less. And also, one Indonesian study shows that low vitamin D patients 10 times more likely to die because of coronavirus. So if your blood vitamin D levels are low, then there is chance that you can, 10 times more likely that you can die because of coronavirus. So they have done this study by checking the uh, checking in 780 people, nearly 700, 780, 400 in one group and 300 in another group. So those are 380 who died had vitamin D status very low, 16. Okay, so those who are survived in ICU, almost 780 people who were in ICU and expired or died, those their blood vitamin D level was extremely low, below 16, and those who are alive from that 780 who went into ICU had higher levels of vitamin D. So two things: you need to have vitamin D in your blood, and you should not have glucose in your cells when you are affected with corona. So an interesting fact that I have noticed: in 1903, Niels Svensson, who won the Nobel Prize in Medicine for his use of ultraviolet in the treatment of tuberculosis. Back in the days, tuberculosis was one of the biggest threat for human, because people are dying because of TB, and tuberculosis was most prominent disease all over the world. But in 1903 itself, Niels Vincent was using ultraviolet light for treatment of tuberculosis. See how maybe the catholicism and defense was in them, those who he was treating, but that was not known that time. But the Nobel Prize was being awarded to him for treating tuberculosis by ultraviolet rays. So the immunological implication of vitamin D metabolism has to be studied a lot, has to be used a lot for the mankind, and has to promote a lot even to get better sunlight. So traditionally also, as I said, even sun salutation or sun bath is also beneficial for maintaining your health. Maybe not when you're falling in sick, but these has to be regularly practiced as a lifestyle to prevent and to save yourself from some sort of uh, infections. So nutrition during COVID. So by combining all this, what all the things you need to follow during your COVID time has been formulated by us, and that can be like this. See, I'll just summarize. Number one, glucose. Glucose should not be there in your diet when you are diagnosed with symptomatic problems of COVID. That's one, by inhibiting hexoaminase biosynthesis pathway. Number two, vitamin C rich fruits. So in interferon lambda will be produced more. Number three, glycerated licorice. Number four, uh, lauric acid and monolaurin. Number five, omega 3. Number six, vitamin D. These are the points that have suggest some evidences based on COVID-19. So a sample diet, it varies from people to people, of course, based on their issues, and if they are diabetic, we will not be able to. If they are hypertensive, we will not be able to follow certain things. But those who are don't have comorbidities and still tested positive, they can go with kind of this kind of diets. Like morning, you can take some lemon or citric fruits juices plus licorice, and then only fruits has fructose, and fructose doesn't go and produce energy. So from from the fruits, the energy, the fructose can be used, and it doesn't reach into the hexaminase biosynthetic pathway. So any fruits and steamed vegetable doesn't have starch. Only 2 to 4% of vegetable has some minimal amount of starch, which is very fine. Coconut grated or related things, because coconut doesn't have any glucose, it is just saturated fatty acid. Licorice and ginger, which is cox inhibitor and even helpful for inhibiting. And nuts also, which is rich in fat, which it doesn't uh, comes and produce the energy there. So steamed vegetables and soups and with ghee, all this are fat, I mean carbohydrate free plus fat related one. So here you will be able to inhibit hexocyte and kinase biosynthetic pathway, so virus replication maybe won't be there, and the natural related citric acids and things would even will be helpful. And what are the supplements that can be taken? Omega 3, one day you need to have at least 1000 milligrams, but during this time you may need to have 3000 milligram. Vitamin C can be consumed. Zinc, probiotic especially uh, uh, culturing a healthy gut bacteria would be a very key factors for resilience of your immunity, because your head of the department of immunities lies in your gut from mouth to anus. So this area is the main area where your immune system is work based on the health of the gut microbiome. So probiotic and prebiotic would be very beneficial for to maintain a good and healthy gut microbiome, thereby resilience to your immunity. And glycyrrhizin kashaya or decoction can be taken 2 or 3 times a day, morning evening time. And also preventive measures as well. You have to get exposed to sunlight at least 30 minutes, like sleeveless or your back is exposed with sunlight, minimum of half an hour daily. That can be a preventive aspect. And food that can be included, pineapple, of course, bromelain, and nuts, fish, eggs, that can be taken for preventive aspects. And licorice and ginger decoctions can be taken. Probiotic buttermilk curd can be taken, because that enhances your gut microbiome, thereby helping your gut to have better immune resilience. Grated coconut milk, because of lauric acids, monolaurin, so you must use coconut based products. If you can take even uh, uh, there is even now available coconut oil capsules, even coconut milk. These are the things that you should include in your diet for preventive aspects. And even prebiotic probiotic combo like flax seeds, fenugreek, sesame seeds, all this are very good for maintaining a good healthy gut. And also consume half kgs of fruits every day, even half kgs of vegetables a day. That's one of the good strategy that you can go ahead, especially guava. uh, um, Guava has very good soluble fibers, almost 10 gram in 100 gram. Guava is very uh, uh, essential fiber that you get it. And also guava is one of the richest source of vitamin C fruit. And also consume large amount of vegetables. These are preventive aspects. So supplements for COVID, if you see some fibers like inulin. Inulin is one of the best fiber that you can choose in your food, and that the same inulin is a soluble fiber which is there in the vegetables, sticky vegetables, and even gut. I mean guava. those things are there. Tinospora cordiflora, there is a herbs that we can use. Vitamin D, at least 1,000 international unit per day, but you can take even 2,000 alternative days. And please also take, when you take vitamin D, this is a fat soluble vitamins, you must take ghee or some fat food in your diet. And omega-3, that is one of the important supplement that everywhere you get it. Omega-3 must be taken even you're a healthy person, because this would help in terms of reducing inflammations, and stages of inflammation like resolzin and protections will be used for third stages of the inflammatory changes. So these are the things that you can use it in your diet. So I um, uh, like to give a credit for Dr. Praveen Jacob and Dr. Ram Saminathan for uh, helping me and making a presentation, and they are my guides. Would like to thank them when I'm completing this. So finally, I would like to give you few evidence-based food items that's been helpful during this time. Number one, less glucose or no starch when you have infection. That's number one. Why? Because it helps to reduce the virus replications and reduce cytokine storm. Number two, you can add very easily, you can add omega-3 in daily basis in your diet. That come from fish or supplement form also, it's fine. And also it is there in seaweed, walnuts are rich in omega-3. Number three, you have to get exposed to sun in a daily basis, whether you have COVID or not have COVID, it doesn't matter. You have to get exposed with sunlight, which will produce defensin and cathelicidin, and that is very important and must for your immune system. And number five, you need to have vitamin C rich food in your diet, and a kind of primary defense. And then number six, there is some herbs like licorice and Tinospora claudifolia are single tested herbs that you can use as a decoctions alternate days. And then the vitamin D, yes, these are the few points. And okay, also in fruits, bromelain, pineapple, these are the things which has some evidences. And even coconut, which has monolaurin, has some evidences suggesting these food should be in your diet, or when you have a problem, you need to include this. By including this, you're not going to have any bad effect, rather than positive promotion of your health. So these been even traditionally said, as I said, uh, uh, Surya Namaskara, also breathing exercise and pranayamas, which is scientifically tested, which will help your lung function. Post recovery, you can practice these breathing exercises, which would help you to have better lung function. It's when the function is almost deteriorated to lower levels. So these are the points you have to note and follow it. And if you have any doubts, you can ask me.
Doctor, thank you very much for your intense, very scientific, evidence-based through research papers, the findings and your advices. There is not much time actually for question answers. Maybe another 5 minutes we can take. One of the questions that would come up is, many times people say that the taste is gone, the smell is gone, during this COVID time, and the food, many patients especially, they don't consume proper food, no nutrition, and that may increase their problems. So what do you suggest, doctor, when the taste is gone, and I mean, how do you follow up with these kind of things?
So when you turn to positive, you tested positive and you don't have much symptoms, Dr. Ashok Jainer suggested that no carbohydrates. You can stay 5 days on liquids with fruit juices or with soups and steamed vegetables, which doesn't give much starch. This invariably, if you have to follow this, even we says like and traditionally we says, if you eat one time you are a yogi, if you eat 2 times you are a rogi, which means you are a patient. If you eat 3 times you are a bogi, which means far away from the patient as well. So traditionally we were eating only once, and that has become 5 times, 6 times, 7 times. That gives immense stress to your cells, cellular stress. So eating very light is always the key when you are having viral infections. So that must be followed. Whether you have taste or no taste, that's fine. But 5 days is the key, that eat less. Then suggesting by other means.
Doctor, what do you suggest after the COVID infection? You know, people have come back and they had after that they had problems. You know, so many death cases we have heard about after the COVID infection, and they became all right and they okay, and then later on they had issues. You know, heart. They say clot in the blood and things like this, and a lot of deaths happened afterwards. I mean, do you suggest any kind of a food recommendation or any rehabilitation
Yeah,
programs?
if it is in terms of lung function, we can of course go with the lots of breathing exercises and pranayamas. And also, if it is related to blood and things, I would suggest omega-3 because it is blood thinner naturally, and that has to be there in our diet. So it is anti-inflammatory, and it is blood thinning, and it is found to be very effective in most of the inflammatory diseases. So I bring balance between 3 and 6s. So 3 should be there in your diet almost all the time. And for improving your lung functions and things, you can start with 30 minutes of exercise. I would suggest 30 minutes of yoga.
That is after the infection,
Yes.
after you come back. So you start with slow exercise and go up to 30 minutes, is it?
Yes, 30 up to 30 minutes. Especially focus on your breathing exercises and try to improve your lung functions.
Okay. Doctor, how do you improve your gut health? You mentioned about the gut health, you know, and is there any way to improve, even if someone is not having a COVID infection or something? How do we have that gut health improved in a short? I mean, I know it's a big subject, but if
Yeah,
you could just briefly say that.
gut health is coming up as a biggest cup of research in many fields since last 10 years. But we know two things, good and bad. Bad is that even if you get a fever, your gut microbiome is going to die. If you have a strong antibiotics, your gut microbiome is going to die. If you eat bad foods, junk foods, your gut microbiome is going to die. So these things are very important. You should avoid certain things. And second thing, what to be needed is number one, prebiotic and probiotic. Prebiotics are bacteria's food. We have millions and trillions of bacteria in your gut, and they are also waiting for food. Their food, their food is nothing but prebiotics, especially which I mentioned, inulin. Sticky vegetables has fiber. These fibers are the food for this bacteria. So you must include at least half kgs of vegetables in your food, and eggs or ghee or butter or curd, yogurt are probiotics. Sorry, only yogurt is probiotic, which are good. Bacteria is there in the food, and even every tradition it is there fermented foods, which are very good to keep your gut bacteria happy. So prebiotics and probiotics are the key, and even ghee, butter, cheese would be helpful. So all this prebiotic and probiotic fiber-rich food is the key to enhance your gut health, and also not to use many other things like junk food, unnecessarily antibiotics, and yeah, even a bad sleep food have an impact on your gut microbiome. So key factors and prebiotic and probiotic for gut health.
Thank you, doctor. I know it's a very big subject, prebiotic, probiotic, and all other inventions that is coming up and researches are coming up. For the viewers, I would request, if you need more information and want to connect with Dr. Arun in the future, you can always contact Aasana Yoga Studio, and then Dr. Arun will be really happy to give his advices, on a personal basis or in a program. So thank you, Dr. Arun, for joining us, because we have a time limit of 1 hour in this Yoga Day run-up event. So especially a lot of events are happening. So doctor, it's a very good program that we have got, and a lot of information that we have received from you. So we can take this forward, and let's hope that people who are watching this get benefit out of it. Yeah, thank you, doctor. And
thank you very much for having me here. If you have any doubts and clarification further, please contact Aasana Yoga so that you can get in touch with me, and I can give the related publications and research and other materials to you for further clarifications and doubts as well.
Thank you, doctor. Okay, bye-bye.